Reg Geary is a 30-bed aged care facility. We're in Melbourne's outer west. We introduced telehealth in December last year and have found it really beneficial to our residents given their frailty and the difficulty in them attending external appointments. It's made it really easy for residents who would not otherwise have attended an appointment to actually go.
Since using Telehealth, it's been really good. I've used it on 2 occasions at 2 separate nursing homes, and what we've found is that it's a real benefit to the patient because the patient can't travel a lot of the time, and it's quite difficult to get the patient out of the facility. There's lots of logistics involved with that. As well, patients can often be immobile and can be quite difficult. So to get the specialist over the telehealth has been of immense benefit for the patient in particular.
Just confirming that Joseph's booked in with Professor Leone for a telehealth consultation. Thank you.
One of the great difficulties I have as a geriatrician is for people to be able to gain access easily to seeing myself as a specialist. And I know that the geriatricians are few and far between in rural areas. So with the person's often reduced mobility and sometimes because of their coexisting problems with memory such as dementia and sometimes also behaviour problems, it means bringing the person to a clinic becomes very, very difficult. So telehealth has really been a very valuable alternative way to see people who would otherwise be denied easy access.
Hello, Joseph.
Hello, Doctor.
How are you feeling?
I'm still very short of breath.
I see. We'll have a chat to Professor Leone about that on Telehealth shortly.
Okay.
Telehealth's very easy to set up. Once you've got a Skype account, it's just a matter of taking the laptop down to the resident, and it can be done by the GP, it can be done by the nurse, and it probably takes about 5 minutes to be ready for the appointment.
Hello, Sam. Hi, Joseph.
Hello.
Hello.
I found telehealth, and particularly when the GP is involved, is a very, very effective way. It gives the GP also an opportunity to provide feedback, ask questions, and then we try to optimise things from there.
Sam, can you please take Joseph's blood pressure and listen to his chest?
A good example was when we actually were able to access a geriatrician. The geriatrician made some really good suggestions, and a patient who was on lots of medications coming from the hospital setting to an aged care facility was able to get off a lot of medications, and in fact the quality of life of the resident improved immensely.
Let's make those changes to the medication. I'm expecting that you'll see a significant improvement in the next 2 days. Otherwise, I'll need to review Joseph again.
I'll organise those prescriptions now.
I'll make sure that staff know about the changes and I will order those medications by this afternoon.
Thank you, that's a relief.
Great. If there's no improvement, please contact me. Joseph, have you got any further questions?
No, I'm okay, thank you.
So the session itself allows for the nurse, the resident, the family, potentially the GP, to all be present at the same time, which means instead of the resident getting to an appointment and being asked questions that they don't remember, or them coming back to us and trying to remember what the specialist said, we actually all hear at the same time. We can assist the resident if they're struggling. We also get feedback from the specialist, so we can implement changes on the spot.
We're able to cut down medications because if they're unnecessary, we're able to improve certain people's quality of life by getting some expert help that they wouldn't readily be available.
It's been very hard taking Joseph to his appointments, and we've spent a lot of time and money, and it's been very tiring.
Telehealth has been wonderful. I can now see and speak to my specialist without having to travel.
Since I've been doing telehealth, I've been able to see patients and GPs with their patients and family in rural and remote areas, something that was never possible before.
No ambulance delays, no struggling with wheelchairs around hospitals, no trying to follow a blue line in a hospital when you can't breathe properly and find a location that you don't know where it is. the consultations take 15 minutes instead of being out for 6 hours or more.